Physical therapists, have you ever wondered how treating patients with cancer may be different from your typical orthopedic caseload? Because there are some differences. And here in part 5 of Orthopedic PT Meets Oncology, we're breaking down 6 key differences that make cancer rehabilitation unique and why these differences might just make this work a really rewarding part of your career. Glad to have you here. I'm your host, Oncology PT, Dr. Dr.waltke. Let's start with difference number 1. Cancer PTs frequently treat or provide surveillance over a longer period of time. Cancer treatment and recovery can span months or even years as patients undergo sequential cancer treatments like surgery, chemotherapy, radiation, and then perhaps hormonal and biological therapies. Since each of these medical modalities can create musculoskeletal, cardiopulmonary, integumentary, and/or functional deficits, your role will evolve as your patient's treatment regimen and needs change. You may start with treating postoperative pain and dysfunction, then months later move to treating chemo-related fatigue or balance issues from neuropathy. And then months after that, focus on range of motion and skin restrictions related to radiation. And even when treatment ends, patients often grapple with both long-term and late side effects, requiring your surveillance, skill, and expertise long into survival. This creates the opportunity to build deep, meaningful relationships with your patients. It's also quite normal to see patients one time a month, one time every other month, or even every 6 months if needed. Difference number 2. Oncology patients often deal with pain and dysfunction related to scarring and fibrosis, which, if goes untreated or undertreated, can impact them for months or years. This makes manual therapy a significant part of cancer rehab. And this surprises a lot of people. But think of it this way. In orthopedics, the surgeon opens, fixes something, and then closes. A cancer surgeon, on the other hand, will open, carve out some tissue, and then close. This can lead to scarring and restrictions. And then this may be further compounded by the fact that this area typically may be radiated, adding in potential fibrosis. Thus, manual therapy may be very likely an important part of your plan of care. Soft tissue mobilization, edema mobilization, scar management become essential tools in your arsenal. Difference number 3. In cancer rehab, you'll treat both current impairments and dysfunction and pending impairments and dysfunction. For example, when you're working with someone post-cancer surgery to restore things like normal strength, range of motion, and function, if the patient has pending chemotherapy or radiation in their future, evidence strongly suggests they will be best served if you address that now. And most often, this is done with an exercise prescription. So someone recovering from head and neck surgery may be started on the treadmill and a home walk program. A person recovering from breast or lung cancer surgery will be on your leg press machine and taught squats and lunges for home strength. Your focus will help them handle what's coming. So again, you'll treat the current issues your patient has while also preparing them for what's ahead. Cancer rehab is both reactive and proactive care. Difference number 4. In oncology, team medicine is a standard of care and usually includes a very large number of professionals. So in cancer care, you're not working alone. This collaborative approach means you're contributing to a comprehensive plan that supports your patient on every level. Cancer care typically attracts pretty amazing and bright colleagues, so they are a delight to work with. This collaborative approach elevates you and is not only life-saving, but also highlights the power of interdisciplinary teamwork to achieve extraordinary outcomes. A 5th reason cancer rehab is a bit different than traditional areas of rehab is that patients are typically more engaged. Yes, most people after a major surgery or neurological issue or illness love their PT. Yet in cancer care, that is even a bit more heightened. Cancer can change how people think about their bodies and their health, and they often feel as if they are in the fight for their lives. Patients with cancer tend to be highly motivated to participate in therapy, and they are happy to be somewhere, aka your clinic, where they feel in control of their own health and can make themselves feel better and stronger. Also, for patients with cancer, the manual therapy and movement-related treatments typically feel really good, and home exercise prescriptions aren't too complicated and have immediate positive impact. Another bonus is even though these patients may be sicker and busier than typical, because of the value and immediate benefits, the cancellation and no-show rate for people with cancer is usually much lower compared to ortho. All this leads to impactful and rewarding work. And reason number 6, study after study shows exercise improves length of life after cancer and improves overall survival compared to cancer survivors that don't exercise. So everyone with a cancer diagnosis, regardless of age, gender, type of cancer, or fitness level, should be on a long-term exercise prescription. Yes, everyone. Exercise isn't optional for cancer survivors. It's essential. It's that important. But here's the challenge. Your patients with cancer may face more barriers than your typical ortho population, like fatigue, pain, fear, time, and financial toxicity. Your job is to tailor the care plan and prescription to their unique needs and to help them stick with it for the long haul. So in a nutshell, cancer PT involves treating the musculoskeletal, cardiopulmonary, integumentary, and functional deficits resulting from surgery, chemotherapy, radiation, and other cancer treatments. Cancer rehab should be available for any person undergoing cancer surgery, chemotherapy, or radiation, regardless of what type of cancer they have. It involves longitudinal care over potentially a significant amount of time. It is in collaboration with a team and a focus on helping them live their best life with and beyond cancer. Thanks again for joining me, and congrats, you have completed 5 of the 9 sections in Orthopedic PT Meets Oncology, Your Untapped Potential, Cancer PT 101 series. As always, contact information, relevant links, resources, references, and info on continuing education options for cancer exercise and more courses designed to make you the go-to PT for cancer rehabilitation can be found in the video description. And please, now I would love it if you would take a moment and drop me an email or comment. I'd love to hear about your challenges and successes, your favorite patient impact story, your thoughts on this course content, and or your feelings on having seen your first cancer patient or about seeing your first cancer patient. If you have watched parts 1 through 5 straight through or have been sitting for a bit, please take time now to get up and stretch for a bit. In the next Cancer PT 101 Part 6, we're talking about building exercise prescriptions for people during and after cancer treatment.